My name is Edward Cornwell. In today's society, we come to refer to an individual as iconic for their accomplishments, their originality, their influence, their distinctive excellence, and frequently their association with a distinct era of time. Among a myriad of criteria that might be used to identify the true icons in surgery, leadership of our national and regional surgery and specialty societies can certainly focus our lens on an elite subset of academic surgeons. We know of one and only one surgeon who has been president or chair of these 9 surgical societies, Dr. L.D. Britt. And when you consider that he is among the youngest of a generation of black academic surgeons emerging from the segregated South, you get the time and era framework that describes one of the most impressive career arcs in all of academic surgery. But if we look at the chronology of your life, if anybody is younger than you, they probably in the South, educated in the South, they probably were among the first generation that went to integrated schools. Anyone that's older than you who was educated in the South likely went to segregated schools. So you really stand at the historical dividing line of an evolution, really a revolution in American life, and in particular in education of Americans who were born and raised in the South. So start us off by giving us some influences and early memories of your life as a young child born in Suffolk, Virginia, the influences of your parents and other influential people in your life.
Okay. Well, number one, you're right. I was born in the South. Actually, I'm a product of the Jim Crow South. I had no financial inheritance. I had no influential friends. I just had the love of my parents and the support of the community. So I'm a proud native of Virginia. And I'm going to highlight what you said. I was still part of the segregated South. I finished high school in 1968. They integrated the school system in 1969. So I was part of that. And I didn't know integration, Dr. Cornwell, until I went to the University of Virginia in 1968. Prior to that, segregated buses, segregated parks, segregated theaters, segregated schools. So again, I would say a lot of people don't realize the American bald eagle never flew over Jim Crow South. I never saw the American bald eagle flying over, but I didn't let that discourage me. In fact, it was a driving force for me. I was born in a family of educators. My mother was a school teacher in the public school system, the segregated public school system, for 49 years. Dr. Cornwell, she taught the 3rd grade, the grade that I skipped. My aunts were teachers. My uncles were teachers. So I came from an education background. And then my father was a rigger for the Norfolk Naval Shipyard. So he had a work ethic. So I had work ethic, education, all that support.
Although L.D. Britt was just a baby when the Supreme Court ruled in May 1954 in the Brown versus Board of Education case that state-sanctioned segregation of public schools was unconstitutional, change was slow to come. In May 1955, Brown 2, the court instructed states to begin desegregation plans with all deliberate speed. Virginia was one of the slowest states in the Union to comply due to legislative and civic responses known as massive resistance, organized by the powerful U.S. Senator from Virginia, Harry F. Byrd. Some schools and even school districts in Charlottesville, Norfolk, and Warren County went so far as to close their public schools for years rather than comply with court orders. Consequently, L.D. Britt graduated from all-black Booker T. Washington High School 14 years after the Brown versus Board of Education ruling, and his life's chronology places him squarely on the historical dividing line regarding change in public school educational experience in Eastern Virginia.
Well, if I did not have a strong family, if I did not have a strong support of the church and the community, because we had deprivations, we had segregation, we had inferior schools, we didn't have updated books, we didn't have all the adjuncts to enhance my growth and development. But you know what? The family did it, this church system did it, the community did it. So I was enriched that way. But make no mistake about it, we had some disadvantages.
Uh, what role did athletics play in your personal development?
It played a big role because I had that same sort of philosophy about Greeks, mind and body. So I always stayed in shape. I participated in athletic sports, not as much as your son, but I was successful. But remember now, we had a different sort of athletic system. It was all segregated. We had, I would go to Franklin to play Hayden. These are all segregated schools that I played against.
Hmm.
And my class didn't have more than 35 people.
Wow.
And so it was easy for me to be captain and a star.
Dr. Britt's most influential early role model towards surgery was part of a growing tree of influence that sprang forth from the efforts of Dr. Charles Drew.
His father delivered me. I'm talking about Dr. William Hoffler. There were only 3 physicians in my area, in my city. And so I knew inequalities. I knew healthcare disparities. He delivered me. And I had an injury playing football. And he said, I want my son to see you. So his son came down from I think, Washington, I forgot where. And he came into the room, an examining room. I was sitting with my mother. And he came in confident. He was tall, handsome. And I told my mother, I want to be like him. It was William Hoffler was the father, but the person who was the surgeon was Dr. O.W. Hoffler, who was a resident under Dr. Charles Drew at Howard. So I owe him a great debt because he started the mentoring. He started me thinking about being a physician, a professional, and a surgeon. And later on in my career, we got close. So I would have to say O.W. Hoffler. Outside of my parents, he was a major force for me.
LD excelled at UVA. He was on the honor roll all 8 semesters and decided to pursue both his MD and Masters of Public Health at Harvard.
Well, let me tell you, when I was at the University of Virginia, I went to my counselor. I was second year, and I said I want to go into medicine. And I asked him innocently, I said, where's the best medical school? And he did this not maliciously. He said, well, the best medical school is Harvard. And then he said, but I wouldn't set my sights that high. As soon as he said that, I locked in. And so I went to Harvard. And the reason why I did public health, did an MD, MPH, because I came from a background where we had inequalities and disparities. I wanted to be able to be a physician, particularly a surgeon, who could impact N equals the population, not just the patient. I wanted to obviously give good patient care, but I wanted to have a more broad influence. I thought the public health would help me with that. I finished medical school, did an early part of my training at WashU, and did research, was interested in transplantation. But then I went to Cook County Hospital, University of Illinois Cook County Hospital. As you know, Dr. Cornwell, it was the first trauma center, and that's when I fell in love with taking care of the acutely ill and the acutely injured patients. I don't think anything is more difficult than internship. I would never want to do internship again. I'll tell anyone that. I don't care how much you put, lipstick on a pig, is still a pig. Internship is difficult. So it was a difficult year. I met the challenge, again, being on call, and it was a tough transition, but I made that transition. But I knew medicine would be hard, and I knew surgery would be hard.
At Cook County, Dr. Britt would meet the surgeons that would set the course for the rest of his career.
Well, I can tell you, Dr. Haran Abkarian, and at the college they have an Abkarian lecture that I gave. Dr. John Barrett, who's the head of trauma. Dr. Robert Baker, along with Dr. Freock, who started the trauma center. Dr. Olga Jonason, the first woman established surgeon, was the chief at county. Dr. Lord Nehus, who defined modern management of hernias. So I had some great influence, and they were all great surgeons too. Because I knew I wanted to be a trauma surgeon, but I wanted to go to the best fellowship. I knew I was well trained, so I knew how to operate on injured patients and all of that, and do a lot of things, surgical oncology. But I wanted to have fellowship training, and the best fellowship program at that time, and in my mind, I'll whisper this, even now, is the Shock Trauma Center. And so I went there and learned, obviously, critical care, because I wanted to be board certified in critical care. Because at the end of the day, even back then, surgeons were they were becoming distant from taking care of critically ill patients. And I wanted to still have the expertise in taking care of the critically ill. And so the Shock Trauma Center allowed me to brush up on my skills, trauma-wise, and particularly administratively, and to also sit for the board exam for critical care. So that's why I went to shock trauma. I knew that I was going to be a leader in my home area. I didn't know about national, I didn't know about international. I knew I was going back home when I finished. And I knew that I was going to be a leader in the healthcare system regionally and locally. And that's what happened. I got involved with the chapter, the Virginia chapter of the ACS. So I did all my work regionally. And also, Dr. Cornwell, because I went back to help the inequalities in my community, I did pro bono care. Every week, every Tuesday, I would go to Suffolk. The school sponsored me to have an office, and I would see patients if they had money. If they didn't have money, most of them didn't have it, and I would make house calls. I did that for 25 years. I didn't have any political aspirations. I just wanted to go back home and do academics. And they only had one medical school. It was EVMS. People couldn't even spell EVMS. So they recruited me. I wanted them. And I've only had one job. I started in 1986, and I'm still here. I became chair, and I didn't predict this. It just evolved that way. I became chair in 1994 and program director. I was one of the longest program directors until I gave it up a few years ago, but I'm still chair. I've only had one job, one employer in my entire life.
And what a journey it's been. Service and growth, right up to leadership of every major regional and national surgical organization in his field. Service to the community, every major teaching award available, a scholarship fund bearing his name, and such a sterling record of service and accomplishment that they built a statue to him outside his office while he's still on the job.
That was not my aspiration to be a leader of all those organizations. I was very fortunate, but I wanted to I had a work ethic, and I knew I wanted to be excellent. So I worked so hard to be the best, not to evolve into these leadership roles. I just wanted to be the best clinician, the best surgeon. And when I was in a committee or organization, I wanted to be of value. I don't want to be necessarily successful. I wanted to be of value. And as a result, I was rewarded with leadership roles. I wanted to leave my trademark. And my trademark is one word: excellence. I didn't have any other weapons. I didn't have money, but I knew I could be excellent. So excellence to me was my gasoline. That was my fuel. And that's what I would tell young people. At the end of the day, you need to be, when the curtain goes up, you can't be an emperor on the stage with no clothes on. You need to have clothes on. Those clothes are excellence. You're expert in your field. You're expert in taking care of patients operatively, and you can't do that by cutting things short.
So the line is clearly drawn from Drew through Hoffler to Britt, and the common template is excellence. Dr. Britt is part of a small group of surgeons who proposed that trauma surgeons were best equipped to care for other critically ill surgical patients.
I saw my profession. I saw trauma being disrespected. People didn't want to do trauma because it was mostly non-operative. It didn't have the glamour. It didn't have the financial support. So, and I also realized that we weren't taking care of emergency general surgery in an optimal fashion. Whoever was on call, they didn't want to be on call. Emergency would come in, they would come to the hospital maybe late, and so I said, look, trauma is not attractive anymore. Why don't we join that along with emergency general surgery? And I've always the interest in surgeons being involved in critical care. I said, why don't we put that together? Trauma, emergency general surgery, and critical care, and come up with a specialty. And I said, what would that? I don't want to call it emergency surgery because they'll get us confused with emergency medicine. So I said, why don't we call it acute care surgery? And sure enough, we embraced it. I authored that. I thank my colleagues for that. And that is one of the most respected specialties there. I think my best accomplishment, my greatest honor, because I just had my graduation, is training a resident and seeing that class graduate and seeing them do well. There's no honor better than that. I am happy that I contributed to American surgery with acute care surgery and all the things I've done, but my greatest accomplishment is training surgeons and seeing them graduate and go on and obviously practice their profession and discipline.
I want to touch on, as you did this, you talked about, you deferred some of the other balances of life. You and your lovely wife have raised a Harvard-bound student, continuing that legacy. That's amazing in my mind. I think about, as we pursue a more complete society, this son of the segregated South decides to have the audacity to be one of the 12 students, black students at the University of Virginia. He goes on to Harvard and sends his daughter to Harvard. So that just makes me smile. But there's something about Dr. Britt, the Renaissance man.
But one of the things I enjoyed was being president of the Norfolk Forum, which is a lecture series. It's the longest running publicly supported lecture series in the country. But it was my commitment to the community. And then I felt, and I tell my graduates this, you're not complete as a professional if you don't expand yourself beyond the walls of a hospital, medical school, and go into the community. And that's what I did. When I became president, I looked at all of the history of the college. I looked at their mission. I looked at their vision. And I realized, I said, something is missing. And in my talk, as you remember, I said there is no quality, which is one of the cornerstone components of the college. I said there is no quality without access. And everyone listened. And I give David Horter a lot of credit. He listened. And then the college started saying we need better access. We need to promote that. We need to advocate for that. And that started, obviously, some of the advocacy committees. I had a committee on disparities, and there's a healthcare committee on disparities. But it started with my desire to have the college broaden its scope and not just talk about quality, but talk about access. Because at the end of the day, you know, the greatest pivot that in American history that we made in American history was the Civil War, and we need to pivot again now. Obviously, pivot for optimizing healthcare, and I call it inequalities. We need to get rid of healthcare inequalities, and so we need to pivot that way, like we pivoted in the Civil War. That's our charge.
One of your main projects in terms of the workforce was to pursue, with my friend and colleague, our current chair here at Howard, Dr. Fulham, the Diverse Surgeons Initiatives, looking specifically at a subspecialty of minimally invasive surgery. Tell us about that project of yours.
That was key, and I'm going to give Dr. Fulham, who's your chair now at Howard, was an architect. He was the architect of the Diverse Surgeons Initiative. He recruited me, but we wanted to obviously increase the workforce, and we did by obviously inviting people to come to the program. We would train them in minimally invasive, but also we will mentor them, and we will provide everything. And those people, we've had unbelievable alumni. Czar Cooper up at the Brigham, Patricia Turner, I can go down the list. It has been one of the most successful programs in my life.
So there you have it. A life's journey with modest beginnings and a mentor tree that traces back to the pioneer who also spoke of the transcendent power of excellence. LD Britt shares the attributes of other acclaimed leaders with modest beginnings. It's been an honor to share the story of this true icon of surgery.